Hi, I'm Rick Kaler. Thanks for joining me. The soaring cost of healthcare in the United States is painfully obvious to anyone who looks at a medical bill. This aspect of our system has been out of control for decades. A recent study by the Kaiser Foundation compared healthcare prices in the U.S. with those in other developed nations, virtually all of which have some form of universal healthcare. It found ours to be the highest in the world. The average American spends more than $10,348 a year on health care, amounting to a total of 18% of our gross domestic product. The average for citizens in other developed countries is about half that, or $5,198 a year, just 9% of their country's total GDP. Now, despite paying more, Americans average fewer physician consultations. Our rate of about 3.9 per person per year is well below, again, almost half the 7.6% average in other countries that were studied. The researchers also found American hospital stays to be shorter, averaging 6.1 days, while the average in other countries was 10.2 days. The Kaiser study also compared costs for several expensive drugs and various medical procedures, including angioplasty and coronary bypass surgery, MRI exams, colonoscopies, appendectomies, and knee replacements. Costs in the U.S., well, they were significantly higher. In fact, the average cost of replacing one knee in the United States is $28,184. That would almost pay for two new ones in Australia, where the average cost per knee is $15,941. The study doesn't attempt to assess the impact of the Affordable Care Act on U.S. medical costs or to offer any suggested solutions. Nor does it address the respective tax burdens of various countries. Now, this last is a shortcoming of the study that I think is really important to consider. Many of the European countries that feature significant cradle-to-grave universal health systems also have considerably higher taxes than does the U.S. According to the data from the Tax Policy Center, the taxes at all levels of government in many European countries exceed 40% of GDP. Taxes in the U.S. are low in comparison. For example, in 2015, U.S. taxes represented 26% of GDP. That's 14% lower. Of the 34 member countries of the Organization for Economic Cooperation and Development, that's the OECD, only 4 of those 34, Korea, Chile, Mexico, and Ireland, collected less than the United States as a percent of GDP. It may not be surprising then that these countries generally provide more extensive government services than the U.S. does. Let's put this into perspective. If Americans pay 18% of GDP in health care costs, but they spend 14% of GDP less in taxes than many European countries, that would leave us paying a net of 4% of GDP for health care. 18 minus 14, 4%. This is almost half of what Europeans pay at 9%. Perhaps the lower amount we actually spend on health care is explained by the fewer physician visits and shorter hospital stays. Now, certainly not all of the 14% higher GDP and taxes collected by European nations go only to healthcare, but still, it's absolutely reasonable to assume that a significant portion of it does. Even if of that 14%, only 10% goes to healthcare, That would make what we pay in GDP equal with the European nations. Another fact that is often omitted by studies critical of the U.S. for not having universal health care is that the U.S. does have government-funded health care that, and my figures are as of April 2018, covers over 130 million people through Medicare, Medicaid, and CHIP. This compares, and these are 2016 numbers, with some 179 million people with private insurance. In addition, many U.S. citizens currently qualify for health insurance premium subsidies. A family of 4, for example, with an income of under $72,000 a year would qualify for these subsidies. The high cost of U.S. health care is certainly a serious problem, and it needs to be addressed. However, a valid comparison of costs here to those in other countries needs to include the differences in tax burdens. Thanks for joining me.